Hello, my name is Natasha Alvarado and I'm a Senior Research Fellow based at the University of Bradford, and my poster is about our realist review of the implementation and impact of multifactorial falls risk assessment and prevention strategies. So to provide a bit of background, falls are one of the most common type of safety incident reported in hospital, and they can have a devastating impact on patients, including physical injury and a reduced confidence mobilising and fear of falling. And in the UK, the National Institute for Clinical Excellence recommends that patients at risk from falling receive a multifactorial falls risk assessment to identify their individual risks and then to receive tailored interventions to address and manage those risks. But we know that there's variation in how and the extent to which those practices are implemented. And the aim of our review was to explore that variation and to understand what supports or constrains implementation and impact. So we used realist review, which involves a cycle of constructing, testing, and refining hypothesis in the form of context, mechanism, outcome configurations. So basically, they're explanations of what might work for whom, how, why, and in what circumstances. And this poster focuses very much on stage one of the review, which was about CMO construction, so the development of tentative hypothesis that would then need to go on and be tested in stage two of the review. And the poster just shows the processes that we worked through in order to complete stage one. And I just want to focus on the sort of the outcomes of what we found. So from the 78 papers included in the synthesis, we were able to develop 24 CMOs, some of which focused on implementation, which was about how practices became routinized, and some of which focused on how the implementation of those practices would lead to a successful reduction in falls risk for patients. And we discussed these 24 CMOs with our lay research group and the study steering committee, and were able to prioritise 4 mechanisms to take forward and test in stage 2 of the review. So 2 of those mechanisms focused on implementation and included leadership and facilitation. So leadership is the idea that where there's an individual with expertise in falls and time dedicated to falls prevention, they would work to ensure that falls prevention remained a ward priority and that staff were engaged in the delivery of the recommended practices. And facilitation referred to this idea that tools, including digital technologies, were being used to integrate those practices and to facilitate the delivery of those practices for ward staff. So, for example, the use of prompts and reminders in electronic health records used by ward staff for each patient. In terms of reducing falls risk, we prioritise shared responsibility and patient-centred care. Shared responsibility referred to an idea that reducing falls was the responsibility of all ward staff. So where patients' falls risk were communicated effectively between the ward team, they would have a sense of collective responsibility and remain vigilant for at-risk patients, and also participate in prevention strategies for each patient. And patient-centred care was like the other side of that. So this idea that where these practices were delivered with patient preferences and needs at the heart of the assessment and care plan process, patients would participate in the prevention strategies also, because they would understand why they were being used, and they would also be appropriate and tailored to their needs and capabilities. So the idea is that we want to test those ideas going forward in stage 2 of the review using empirical data in the literature. And we're particularly interested in exploring the relationship between the implementation of these practices and a reduction in falls risk, because some of our findings from stage 1 suggest that even where they're successfully implemented, it doesn't always lead to a reduction in falls risk. So we're really interested to explore that relationship further. Thank you very much for looking at my poster, and if you have any questions, please do use my email. Thank you.